So tomorrow is the last day on the job for New York City Health Commissioner Ashwin Vasan. He is the latest in a mass exodus from the Adams administration following a corruption scandal.
So Vasan initially said that he would stay through the beginning of next year, right, 2025. But in a surprise announcement earlier this week, that timeline was moved up significantly. Now, the doctor has not at all, to be very clear, been connected to the federal investigation impacting City Hall. When we initially invited him on, it was to discuss preparing for flu and COVID season, which we will discuss. But for now, let's welcome Dr. Vasan and talk about a little bit about your time as the health commissioner. So thank you for being here on a very important day.
My pleasure. It's always great to be here, and I've always appreciated our conversations.
So, Doctor, I'm sure the question is why now, right? Because it was 2025, early 2025, and then that timeline was moved up pretty quickly to tomorrow. So what was the change in timeline?
I've been thinking about this for a while. I've been talking about this for a while with Ann Williams-Isom, our Deputy Mayor for Health and Human Services. I have 3 small kids. You have a small child, I know. I think you have kids. You have 2. And they serve with you. And I haven't been there for them for nearly 3 years. And the needs of my kids have evolved, and particularly school needs. And I need to be there for them. They need their dad, and I'm excited to be spending time with them. I'm also extremely confident in my team. We've got a fantastic leadership team. We are so much stronger than when I arrived, when I was appointed at the end of 2021. We had, I think, like a 33% or over 30% vacancy rate. We've shrunk that down to closer to 10, below 10. We've recruited national leaders into running our key divisions, and we have a great chief medical officer, Dr. Morris, who's taking over for me on an interim basis, who I have full confidence in. And so the work of the agency goes on. There's 7,000 fantastic civil servants who come every day committed to this city. And I have to say it's been an honor of a lifetime to have this role.
Can you talk about the transition then? Because you're leaving behind quite a legacy, but what can you tell us about Dr. Morse?
She's wonderful, a nationally and internationally recognized leader in health equity and social justice and internal medicine. She's been at the health department for 4 years. So she arrived in 2021, early in 2021, during COVID, and led some of our vaccine equity efforts, particularly with NYCHA housing complexes. So she knows what she's doing, and she's ready to step up.
Doctor, I'm sure when people look at this, right, they're going to say, well, he's leaving because of the scandal in the administration, right? I know you just laid it out as to why, but you're going to have those who are going to say, well, no, he's leaving really because there's a scandal plaguing City Hall and there's a mass exodus. Did the mayor ask you, can you move the timeline up? Because it seems like some people's timelines have been moved. The school's chancellor's timeline was moved up. Was that conversation part of it at all? Can you see why people might say, well, he just wants to get out?
I mean, people say whatever they want. I think it's silly season in many ways, but my decision was my decision alone. 100% my decision, 100%. There was never any conversation related to any of those ongoing activities or issues, and those aren't really my issues, nor my concern. My concern is for this city. All of my conversations with everyone in this administration have been about the health of the city yesterday, today, tomorrow, for the last time, and even beyond. I'll continue to be an advocate for this city. And the great news is, and I guess maybe one of the sad parts is that it lost in all this shuffle is all the fantastic accomplishments in the last 3 years. We set our city out on a course for healthier, longer lives permanently, and we passed that into law, and that's going to outlive all of us. We stood up to the Dobbs decision and became a leader in the country in abortion access, setting up our abortion access hub, where now 25% of the women coming to New York are from Georgia, Florida, Texas, Arizona, in addition to the many New Yorkers we're serving. We are addressing affordability in healthcare. We are about to clear $2 billion in medical debt for 500,000 low-income families in this city over the next 3 years. And the list goes on. Investments in mental health. 20,000 teens are getting therapy today, or by the end of the year, having therapy today that weren't getting it last year. I mean, I can rest at night knowing that our kids are going to be healthier. Generations of New Yorkers are going to be healthier because of the work of our agency and the work that we were able to do.
Impressive when you lay it out, right? Are you worried that's going to get lost?
No, because we've got a fantastic team that are keeping the train on the tracks with the same priorities. We've got a fantastic deputy mayor, Williams-Isom, who shares my priorities, shares our priorities. And at the end of the day, it's not about me. It's about our fantastic public health department, 200 years old, that's had national and international reach, in addition to affecting the lives of 8.5 million New Yorkers for centuries. And that work continues regardless of who's in charge. And I'm just proud to have had the opportunity to steer it, to point it in a new direction, to put some flags in the ground, and now pass the baton to the next.
But you are going to continue practicing.
Yeah,
right?
I'm going back to Columbia for now, and we'll see what's next. I'm going to really start taking my kids to school every morning and picking them up from after school, and spending time with my wife.
Yeah, they're going to be happy to have Dad back, right?
Yeah, I think so.
All right, let's talk about cold and flu season.
Yeah.
It's ramping up right now, and then a lot of folks are wondering about COVID shot, flu shot.
Yeah.
Talk about what people should be doing right now.
Well, we've got shots for COVID, we've got shots for flu, we've got shots for RSV. And all of them are well matched to the circulating viruses, and we're just at sort of the early stages of respiratory viral season. We are seeing cases go down of COVID from their summer peak, but we expect them to go up. Flu cases are slowly starting to uptick, and RSV will probably follow that same trend. I'm most concerned, and my message to New Yorkers is go get vaccinated today, but particularly if you're in a high-risk group. So that means if you're above 65, if you have a chronic condition, if you're the parent of an infant, consider the RSV vaccine, also flu vaccines. Everyone can go get a vaccine today. You can get them at the same time, and you can go to vaccinefinder.nyc.gov, particularly for low-cost and no-cost options.
That's what we're going to do right now. So you can come on in. We're going to actually get both of us are going to get our flu and COVID shot together, right? Now, let me just ask you this: two things.
I'll go first.
One,
this is Dr. Watkins from
Hi,
the
how
Health
are you?
Department, one of our 7,000 incredible staff.
So just two things. One, on the concerns that people have about getting them together, right? I had that concern. You know, just if it's going to make you tired or whatever it may be, I'm going to get both of them. But what did you say to those folks who may say, "Well, I'm worried I'm going to get them both. Let me get them a week apart"?
That's a totally reasonable concern, because it's very normal to have some post-vaccination fatigue, soreness, and even some flu-like or fever-like symptoms, because your immune system has just been ramped up for a short amount of time. That's why we recommend taking anti-inflammatories. You can take ibuprofen, take Tylenol for the next 24 to 48 hours to tamp down those symptoms, and you should be totally fine.
Okay. But if you have a cold or something, should you wait?
In general, we recommend, if you're actively sick, if you're actively fighting off a virus, wait till you're symptom-free. Okay. But talk to your doctor. That's the best way to.
You mentioned the RSV vaccine. Now, can somebody like myself get it at my age group, or is the RSV vaccine only for an older population like my mother and father?
Yeah, so RSV is really not for people with competent immune systems. So we recommend it for people above age 60. Talk to your doctor about whether it's right for you. People with underlying immune system issues, chronic diseases, and infants. Parents of infants can talk to their pediatrician about whether it's right for them. So it's not for everybody.
Right. Okay. Hazel's getting hers. And then for those who say, okay, I just had COVID, so how long do you wait between having COVID and getting the COVID vaccine?
Yeah, I mean, I think it's totally appropriate to wait a bit. You can wait anywhere from 30 to 90 days.
All right.
But you know, we know that immunity is different, right? Vaccine-derived immunity versus infection-derived immunity, they work differently. They're both immunity of different sorts. So talk to your doctor about when's the right time, but there's nothing that should stop you from getting your COVID vaccine within that sort of month window.
Feels good.
Are you done?
No.
Oh.
I still have one
he's got work
more.
to do.
Okay. So I guess, again, for those who are saying, well, you know, do I have to get it every year? Because there is this kind of like this mentality that's out there that you've always been fighting since the very beginning of COVID fatigue, right? Yeah. So how do you kind of battle that at the same time?
It's not easy, and we're facing it all across this country. You know, we have had a coordinated effort for vaccine skepticism, you know, misinformation. Sadly, we're seeing that play out in our election right now.
We're almost out of time. Sorry.
You know,
swap spots.
We're seeing that play out in our election dialogue right now. That's Pandora's box has been opened on that, and it's on people like me in issues of public trust to really keep emphasizing how safe and effective these are, and to be honest with people. Getting your COVID shot, getting your flu shot is not going to guarantee you don't get flu or COVID, but it's going to do two things. It's going to reduce your risk of getting it, and it's going to ensure that when you get it, if you get it, it's going to be mild disease.
No problem.
While he's doing that, can we ask you about whooping cough?
Sure.
Also, so what's the situation there? And because it's highly contagious.
Yeah, I mean, usually in young kids. We sometimes see clusters in school. Pertussis is not that common, but sometimes we see small spikes. And getting a whooping cough vaccine and pertussis vaccine as part of your routine schedule. That's why we push routine school childhood immunizations.
So that's every year?
No. There's a schedule for the Tdap vaccine, and it's spaced out. But that's why we emphasize routine childhood vaccinations every year as this new school year starts.
Yeah.
Right. Okay.
How you feeling?
Feel good. Yeah. I just feel like I'm exposed.
I feel like we should have background
It's
music.
good. You're normalizing.
Dr. Vasan, thank you so much for being here.
Yeah,
thank you for all your work you've done for the city.
Thank you. It's been my honor.
It's been great working with you, too.
Thank you.
And let me just say, you have been one of the few that have always been available and have always come on during times of need and when people need to hear from you. So appreciate that and hope that the next in line does the same, because it's very important to have a health commissioner that's very accessible.
Thank you.
So
I did my best. Thank you.
And enjoy
my
your
honor.
time with your family.
I will. Thank you.